This is the town of Crawley in West Sussex. The last count I checked for COVID numbers per 100,000 in the area were 1,671, compared to the entirety of West Sussex, just over 600 per 100,000. Now this is during second full national lockdown. It's mid-January now, and I know there are many towns and places that are affected. Much of the news coverage has focused much on the bigger cities like London and Manchester. In my job, I work in local government at the moment. I see emails come in and they inform us of the deaths. It's more than just dealing with people dying, their bodies, their families in the moment of the death. There's also the aftermath. I don't envy that job. That intro was recorded 2 months ago, during the height of winter lockdown in the UK. It was a time when things were at their most bleak. At time of scripting, the UK death toll has hit over 126,000 people, out of a total 4.3 million infected. Today, should this video be out on time, marks the 1 year anniversary of the country going under national lockdown. 1 whole year of lockdowns, deaths and anti-mask protesters. 1 year of government incompetence and misinformation, of lives ruined. Why did the government do so poorly and react so slowly? And what was the action taken in those early days? At 8 p.m. on the night of March 23rd, a Monday, Prime Minister Boris Johnson appeared on national television to announce a national lockdown for England and the UK.
And this country is not alone. All over the world we're seeing the devastating impact of this invisible killer. And so tonight I want to update you on the latest steps we're taking to fight the disease and what you can do to help.
It was 125 days earlier, on the 17th of November, that the first suspected cases of COVID-19 were recorded, with 266 total around that time. Previously it had been recorded as an unknown strain of pneumonia. This came with reports of doctors attempting to warn people about the outbreak being silenced. 33 days later, on December the 20th, COVID-19 was officially confirmed after a 55-year-old man from Hubei province was recorded as confirmed as having the virus. Just 92 days remain until UK is under lockdown. On the 23rd of January, Chinese government imposed a lockdown of Wuhan, 60 days before the UK. This, as it happens, is also the first day a suspected case arrived in the UK, 2 in total, after a mother, patient A, infected her son, patient B. It was on the 29th of January where these cases would end up in the infectious diseases unit at Castle Hill Hospital near Hull. Both would recover fully by 17th of February, 26 days until the UK enters the first lockdown. Oddly, after years of wanting to attend, 2020 was my chance, finally, to visit London Chinatown during the Lunar New Year. Even then my wife was worried about my visiting during a busy time of year. Sadly, what was the legitimate caution on our part quickly became bubbling xenophobia and racism on many others. By Tuesday 18th of February, there were reports that hate crimes against Asian and Chinese communities specifically were on the rise. Students in Southampton had been told to go back to their own effing country, one being called an effing virus by passers-by because they were wearing a mask. In Portsmouth, where I happened to grow up, a bus driver ordered a man off his bus for also wearing a mask. By early May, hate crimes and violence in the UK against South and East Asian people would be up by 21%. It was the 3rd of March, 20 days before the eventual government lockdown announcement, that Boris set out plans to tackle the growing outbreak. Contain, delay, research, mitigate. One key point was to wash those hands. So vital was it that he said it twice. He also reassured us he was going to keep shaking hands. That day alone, he had shook hands with literally everyone in a hospital.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And I think it's very important that we, people obviously can make up their own minds. I think that Matt has said that people must make up their own minds, but I think the scientific evidence is, well, I'll hand over to the experts, but our judges.
By the 12th of March, American cities were already going into lockdowns. 11 days still remain until the UK. On the 15th of March, panic buying was in full swing, with supermarkets and food banks asking people to try and stay calm. Most importantly, think of those already with less. 8 days remain. On the 16th, people were asked to start working from home where possible, and the 17th, Government Chief Scientific Advisor Sir Patrick Vallance, the man seen wincing at "I shake everything, Boris" earlier, said 20,000 deaths would be a good outcome.
Nonetheless, a much better picture than many might have feared. That is the hope, that we can get it down to that. And to put that into perspective, every year in seasonal flu, the number of deaths is thought to be about 8,000 excess deaths. So if we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak. But I mean, it's still horrible. I mean, that's still an enormous number of deaths, and it's an enormous pressure on the health service.
6 days to go. By the 20th of March, the government were announcing both the closure of pubs and restaurants, along with the furlough scheme. It wasn't until 3 days later that a full lockdown was announced. By this point, 335 people had died in the UK. Obviously, the number is actually higher by this point, and both numbers will very quickly jump.
And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home.
27th of March 2020. Boris Johnson announces he is sick, and a few days later a visibly upset Dominic Raab would announce that Boris Johnson was in intensive care on April 6th. For a fleeting moment, a Conservative looked like he may have had a conscience. By the 25th of April 2020, 20,000 people were dead.
Where the number of hospital deaths from coronavirus has risen above 20,000, making it the 5th country to pass the grim milestone. Now, health authorities announced 781 new deaths in 24 hours, the highest number in 5 days.
It would be less than a week before a mostly recovered Boris announced the planned relaxing of lockdown rules. So why and how we managed to pass the 20,000 death mark so quickly? How were so many left to die? Not just die, but die in such horrible and lonely deaths. The jaded part of me might point to a quiet plot on the part of those in power to enact somewhat of a social genocide, but surely that would be ridiculous, right? It is entirely in line with the historical behaviour for this to be the result of inaction, chosen or otherwise. If you don't see care home patients as important, you don't deliberately kill them, but you might not see a point in taking action or spending money to save them either. It's how institutional classism and racism works. Let the fat die, and you won't have to worry about hitting those healthy public targets anymore. Heck, by next year, the percentage of healthy people will so much outweigh the percentage of unhealthy that those targets will be met with little effort. During the summer, through varying degrees of lockdown rules, there were questions as to why things got so bad. Why so many deaths? Why was the UK hit with the worst recession in Europe? Maybe it was simple human ineptitude, shaking hands with the devil at COVID rate. By the start of any future lockdowns, the government would have plans in place, wouldn't they? They would act swiftly to prevent worse fates. January 26, 2021.
The Kingdom is the first European state to record more than 100,000 deaths linked to the pandemic. And according to the University of Oxford, the UK has one of the highest COVID death rates anywhere in the world. Prime Minister Boris Johnson, whose handling of the pandemic has been heavily criticised in some quarters, said he was deeply...
On this day in January, the UK hit 100,000 deaths. And while the news went out of their way to try and make it sound not so bad, the death rate wasn't one of the highest in the world. It was the highest in the world. Once again, Boris and his government's deliberate inaction was to blame. A week before autumn half-term, science advisor SAGE suggested a circuit break lockdown of 2 to 3 weeks to the government. This government chose to ignore this advice. The leader of the opposition, Keir Starmer, here looking like a haunted teabag, also pressured Boris to enter into this action, even suggesting it take place over the half-term break.
That's why I'm calling for a 2-3 week circuit break in England, in line with SAGE's recommendation. A temporary set of clear and effective restrictions designed to get the R rate down and reverse the trend of infections.
But Boris just obsessively rejected this suggestion and barked on about kids in schools. Half-term came and went, and deaths rose. And finally, on October 31st, we were told, after being in a tiered system for some time, that we would enter another national lockdown.
You must
for 4
stay at
weeks.
home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own, with one person from another household, for medical reasons, appointments, and to escape injury or harm. To shop.
Eventually this extended up until Christmas Day. But oh no, we wouldn't sacrifice Christmas Day itself. And so Christmas came. And yet another poorly judged mistake. People were allowed to visit relatives for Christmas. Another mistake with more consequences, more infections, more deaths. It's been 143 days, or bar one, since National Lockdown 2 started. 1 year since our first. 126,284 COVID deaths. The worst recession in Europe. Worst death rate per 100,000. I asked in that intro why no one was talking about this town, how monumentally badly hit it was. But the truth is that there's no words for any of this. Where do you start? So many families broken. So many mistakes made. By all of us. Oh, and I'm looking at both of you anti-mask and anti-vax lots. The terrible truth is that it's unlikely that anyone in power will be held into account for the deaths in this country. I suspect that's very true of many others as well. And before long, before we find the end of this, more will die. And more will face loss, needlessly. We'll never have the words for this. That all the more tragic that it could have been avoided.
And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives. Thank you.